Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff, and tonight we're joined by Dr. Golare Aga, who is our Chief of Informatics here at the San Antonio Metro Health Department. And this is our COVID-19 update for the San Antonio community. We are reporting 101 new cases of COVID-19 today, which brings our total to above 50,000 for the first time. We're at 50,016 total COVID-19 cases in our community since the pandemic began. Our new 7-day moving average has dropped a bit, which is good, and it's down to 128 new cases per day. For the first time in a very, very long time, we are very thankful we have no new deaths to report tonight from COVID-19. That's a great thing. But let's take that moment to remember those who we have lost and to keep their families in our prayers. Again, we've lost over 1,000 people in this community due to COVID-19. Those are loved ones, neighbors, aunts, uncles, daughters, mothers, sisters and brothers, people who are valued members of this community, and their families are mourning, and we are keeping them in our prayers. Over in the hospitals tonight, there are 248 COVID patients in the hospital. That's 18 new COVID-related admissions since yesterday. 105 patients are in the ICU and 51 are on ventilators. Our capacity continues to move up a bit. We're at 68% of ventilators available and 16% of staffed hospital beds available. It's Monday, so let's also take a look at the progress and warning indicators that our public health professionals are tracking. None of the indicators have really changed since last week in terms of where they are with the pandemic. 4 of the 7 indicators are in the dark green safe zone. The positivity rate is down to 6%, almost but not quite to our goal of 5% or less. And the 2 hospital indicators remain in the yellow steady zone. We continue to see improvements in the hospitals, and that's a very good thing. Overall, we remain in the high end of the safe risk level, so please continue to be vigilant and follow the safety protocols when you leave your house. Of course, wear your mask, practice physical distancing, and avoid large crowds. Let me turn it over to Judge Wolff.
Thanks, Mayor. And the numbers do look a lot better, and but we still don't have the data back from what happened over over the holidays, and we won't probably begin to see the impact of that maybe Friday or Monday. We'll see if there's really been any jump or not from that. And we do have people going back to school this week, and we'll know more about that within a week or two. By the way, before I forget it, you may have got one of these from the U.S. Postal Service. Early voting starts on October the 13th. That's, less than a month away. And what they're asking you to do, if you've applied to do a mail-in ballot, that you mail that ballot at least 7 days before Election Day to make sure that your ballot be able to get in. So remember that. Get your ballot mailed in at least 7 days before Election Day. If not, please try to do it earlier. The earlier, the better. When you look at the weekly numbers, they are looking really good. Just in 1 week where we had 304 people in the hospital in 1 week, it dropped by 58 people down to 246. So that's a significant continuing improvement in that area. And as the mayor said, we were at 6.7, I think, percent positive rate, down to 6. Hopefully we'll get down to 5 if we don't have a big blow up from the holidays. And most important, as we test, the best test you can take is the PCR test, which is what we give. You can do an antigen test, but it's not quite as accurate. And the good thing about that is that 80% of all the tests that have been taken have been done with the PCR test, which is a lot more reliable to do. And if you just think over the period of time that we've dealt with this, we've had 3,000 people in the hospital at one time or another. That's roughly, give or take, about 6% of those that have tested positive. So many people do get very sick. Many of them, 2,000 of those, we've had 1,000 pass away, some of which were in the hospital. But even if they did get out of the hospital, they still have some health challenges ahead of them. So we may have had 1,000 pass away, but we had 3,000 of them serious enough to be in the hospital. But we're on the good track, and let's just keep it going if everybody will do the right thing.
Thank you, Judge. And we also want to remind you it is getting towards flu season. We want to avoid anyone getting the flu and COVID. So the best way to protect yourself is to get a flu vaccine. So make plans to do that any number of places in our community over this flu season. Also want to remind you that there are assistance available. There are assistance programs available if you need help with food, housing, and of course getting back to work. We have a workforce development program in conjunction with the county and the city that is actively enrolling folks into job training tracks to get you trained up for jobs that are available today in our community that need a little bit of credentialing that you can get as you receive a stipend to make ends meet. You can get more information on that by dialing 210-224-HELP. And as always, you can get the latest on COVID-19 anytime by texting COSAGov to 55000. You can also go to the website at covid19.sanantonio.gov. That's covid19.sanantonio.gov. We have the Queen of Data, Dr. Golare Aga, here, as well as the judge and myself for questions.
Dr. Aga, this positivity rate that is still 6%, why is there such a small decrease from 6.7 that was the last time that it was reported?
Well, the data is the data. It's what the numbers show when we take all of the labs that provide their positive, negative, and total test to us and get the positive number out of them. So it is natural that it's decreasing ever so slowly. You know, we're not completely in the clear, which is why we're in the right direction, but it is what it is. It's sort of, that's exactly where the number is.
Can you explain a little bit about the backlog cases that were reported from Metro Health that they're going to be added?
Right. So that was about 1575 cases. What we do know is that those backlogs aren't new cases. They didn't have a specimen collection day within the last 14 days or even 3 to 4 weeks. They were a myriad of cases over several weeks that suddenly, due to the state working out the issues with, you know, it's a very complex system, and you have multiple players, multiple labs, multiple providers, multiple counties submitting data into the system. So basically, we get data dumps. You know, we talk about this a lot, and there's no way around it. Then we have to do our own verification on those data dumps to make sure we check it over before we report it to you. So there's nothing particular to say about them. They're not from any one source. They're just due to coding errors from, you know, certain entities that suddenly were fixed and then dumped into the system, verified by us, and that's the 1575 that we reported.
Should we be expecting more backlog cases?
It could happen. It could happen. But again, it's important to understand that when we reported them, they're not new cases, you know, within the last 14 days. So we really try to make that clear in terms of tracking the virus and, you know, what the effect of Labor Day is, or, you know, so I think that's the important note to take away, and we'll always try to be as clear as possible as whether they're backlog cases from several weeks ago versus new cases. So we'll do our best.
How is contact tracing going and case investigators here in the city? I know they're working really hard on tracking everybody.
So we have partnered with UT Health, and we have more than 160 trained. Every day when I walk into the Alamo Dome, including Saturday and Sunday, everybody is vigilantly sitting there doing contact tracing. We've been in a good place. It hasn't been something we can't handle right now. I don't have specific numbers because, again, we're relying on working with our UT Health partners to do this. As far as I'm concerned, it is going well, but we always have issues with, you know, cases that we cannot reach. I think it has gotten better over time, but there's still, you know, we're still working on being able to reach all cases.
And what about the testing locations? How is that going so far?
So I'm not the one to be able to really speak on that well. We have kiosks coming up. We have Ramirez. We have Cuellar. We have Freeman. Tests, I believe test numbers are going down, but in terms of the testing availability and having sites and locations, if you go on our website and you see all the dots on the testing sites that we have, it's still in good shape. There isn't a demand that we're not meeting, unless the mayor knows any differently.
No, we're grateful for the additional kiosks that are being set up by the state. Those are going very well. We expect to have a few more in our community over the next few weeks as well.
Mayor, is there any update on the hurricane evacuees that are still in San Antonio, and are they staying in hotels with vouchers still?
Yeah, so we have still a total of 149 evacuees that are still present in the San Antonio community. They're in 49 hotel rooms. As you know, that we peaked around 4,000, a little bit more than 4,000 evacuees total in the community during that period of time, but there's still 149 that are holding back.
Do we know how long they're going to be here for?
We really don't know. I'd have to get that information from EOC.
Thank you.